Hi everybody, I'd like to talk with you about external cephalic version, ECV, or version for short. This is a procedure where we try to rotate the baby from a breech presentation to a head down presentation. And this is typically done over on labor and delivery at St. Peter's Hospital. 20 years ago we used to do this without an epidural and our success rates were terrible. They were about 60%. But since we've been offering versions with an epidural, our success rate is now about 80 to 90% typically. So let me just describe to you what happens on labor and delivery. When you arrive, they will put you on the monitor. Anesthesia will then place an epidural. After you're comfortable, they would then give you terbutaline, which is a shot to help the uterus relax. At that point, the physicians will come in, and we will do this typically with another resident or with another physician or another midwife, where one of us will lift up on the baby's butt. The other person will try to rotate the baby's head, so we're trying to get the baby to do a forward roll at your belly. Usually we can only do this for about a minute or so, and then our arms get too tired, so we wait. We listen for the baby's heart rate to make sure that it's normal, and then we try again. Typically we will try this once to 4 times. In between we would listen to the baby's heart rates. It's not unusual for the fetal heart rate to actually decrease in between the version attempts, but normally they will go back up to normal. The risks are bleeding, pain, maternal bruising. Sometimes the decelerations don't come back up and we end up having to do an emergency C-section, but that's very, very rare. So in general, the ECV or the version is a very good option for those women with breech babies who don't want to move directly to a C-section. And typically we offer these versions at about 37 weeks. The reason why we offer them at 37 weeks is the babies are term at 37. So in the event that we had to deliver the baby urgently, the baby is still term, and so the likelihood of a NICU admission is much, much lower. All right, so if you have any questions, we'll talk with you some more in the office. Thank you.